You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. Welcome to OET Roleplay Speaking Practice for Nursing, episode number 7. Now, in this episode, let me have a look. What do we have? We have Warfarin therapy. So, the setting is an outpatient clinic. You're the nurse. You've got elderly, middle-aged patient. They've come in and they need to start talking to you about taking Warfarin for atrial fibrillation. Okay, so there's a few things on the task. You have to explain what AF is, why they need to take Warfarin, recommend what herbal products they can and cannot take, address their concerns about nosebleeds, etc. So pretty straightforward stuff. I'll put the script, there'll be a link below to my learning management system. All the transcripts there marked out to the official OET clinical communication criteria. So as you know, you can practice your pronunciation with the audio. You can pause it, repeat back. You've got the script with some good phrases, as I say, mapped to the criteria. I'll put a link to a couple of videos that I recently made and I posted on YouTube. I put the links in the last Doctor Roleplay, in which I explain how you can use these role plays here on Spotify and how you can use artificial intelligence to get extra speaking practice. So I'll put the links for those and all my other links below. So have a listen to the role play and I'll be back once it's finished.
Good morning, my name is Sarah, one of the nurses here in the outpatients clinic. Can I just confirm you are Mr. Dean and you've come today to talk about starting Warfarin for your atrial fibrillation, is that right?
Yes, that's right. I was told I need to start Warfarin, but I'm not really sure why I need this therapy.
Let me briefly explain, Mr. Dean. With your current condition, the top chambers of your heart beat in an irregular way so the blood can swirl and form small clots. If a clot travels to the brain, it can cause a stroke. Warfarin is a blood thinner. It makes your blood less likely to clot and reduces your risk of stroke. Does that make sense?
Yes, it does. So it's mainly to stop clots and strokes.
Exactly. It doesn't cure the irregular heartbeat, but it protects you from that complication. You'll be starting the tablets from today. You'll take Warfarin once a day at the same time every day for the next 4 weeks. And your doctor will adjust the dose based on blood tests. It's usually long-term treatment, so don't stop it suddenly without speaking to your doctor.
If it prevents a stroke, that sounds important. I'm not on any other prescription medicines, but I do take some herbal supplements and I really don't want to give those up.
I'm glad you mentioned them. Some herbal products can interfere with Warfarin. They can make bleeding more likely or allow more clots to form. Which supplements are you taking?
I take a ginseng one and a garlic one and sometimes St. John's wort.
Those are exactly the kinds of herbs we worry about. Your doctor may ask you to stop some of them because of the increased risk of bleeding or clots. The safest thing is not to change them on your own. Instead, take a full list of your supplements to your doctor or anticoagulation clinic and ask which ones you can safely continue with Warfarin. Until then, please don't start or stop any of them without checking. Is that okay?
Yes, I can do that. It also reminded me, my father takes Warfarin as well, and he sometimes gets nosebleeds. What should I do if I start getting similar side effects?
That's a good question, Mr. Dean. Because Warfarin thins the blood, you may bruise more easily or notice small bleeds, like mild nosebleeds or a bit of bleeding from the gums. A small nosebleed that stops within about 10 to 15 minutes is usually not an emergency. But if a nosebleed goes on longer than that, or you see blood in your urine or stools, or you vomit blood, or you have a sudden severe headache, you should seek urgent medical help straight away. But don't worry, I will give you a leaflet that explains this to take home.
So little things can happen, but if it keeps going, or if it's anything big or unusual, I need to get help straight away.
Exactly.
Are there things I need to avoid while I'm taking this medication?
Yes, a few precautions will help. Take your Warfarin at the same time every day. If you forget a dose, don't double up. Just take the next one at the usual time and mention it at your next clinic visit. Avoid over-the-counter painkillers like aspirin or ibuprofen unless your doctor has said they are safe, because they can increase bleeding. And we need to talk briefly about foods that contain vitamin K.
I've heard there are foods I should avoid, but I don't really know which ones.
Vitamin K is involved in blood clotting, and Warfarin works by affecting how your body uses it. If you suddenly start eating a lot more foods high in vitamin K, it can make Warfarin less effective. These are mainly dark green, leafy vegetables like spinach, kale, broccoli, and Brussels sprouts, and some green juices. We don't want you to cut them out completely, but we do want you to keep the amount fairly steady rather than having huge portions one day and none the next. You'll also get a simple leaflet with a list and some guidelines.
Yes, that would help.
So the idea is a normal, healthy diet, avoiding big sudden changes and checking with your doctor or pharmacist before starting any new supplements or special diets.
There's a lot to take in, but it's much clearer now.
I'm glad to hear that. Let me quickly recap. You're starting Warfarin today as a blood thinner to reduce your risk of clots and stroke from atrial fibrillation. You'll take it once a day at the same time for the next 4 weeks, and your doctor will adjust the dose based on blood tests. Some herbal supplements may need to be stopped because they can interfere with Warfarin and increase the risk of bleeding or clots. You should seek urgent help if you have any prolonged or unusual bleeding or other worrying symptoms. And you should keep your diet, especially vitamin K-rich foods, fairly steady. You'll have written information to take home.
I understand better now why I need the therapy and what I should look out for.
That's good. Do you feel comfortable going ahead with Warfarin now?
Yes, I do. I'll follow the advice and talk to my doctor about the supplements.
Excellent. If any new questions come up later, you can ring the clinic or ask your doctor at your next appointment. For now, we'll get you started on the tablets and arrange your follow-up.
Thank you very much.
So, very good. I hope you found that useful and interesting. So, as I said, links below. You can contact me, add me on LinkedIn. You can book lessons on italki. You can check out my YouTube, where I've got lots of videos for OET writing, and these role plays are on YouTube as well. So there's all the links there, all my different things, my General English podcast, as I say, my YouTube, all my other stuff. Okay, so you can have a look at those, and like I say, feel free to contact me anytime if you need any assistance, either writing or speaking. There's going to be a new video, I don't know when I'll have time, looking at OET reading, especially part B and C, which I know that many of you nurses and the doctors too have some problems with. So I'm writing a booklet of key vocabulary that you need for part B and C, and there's going to be a video to explain it all. So I hope that helps. Check out all the links below, and see you next time.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.